I'm really excited to share about a recent publication that came out in February looking at the association between semaglutide and NAION. So as most of you know, semaglutide is a GLP-1 receptor agonist and a very popular type 2 diabetes and weight loss medication. And the middle of last year, exposure to semaglutide was linked to an increased risk for an entity called NAION, or Nonarteritic Anterior Ischemic Optic Neuropathy, which is basically a stroke of the optic nerve that leaves about a quarter of eyes with vision that's considered blindness, for which we have no definitive treatments. And the original publication that came out found that patients with type 2 diabetes who are on semaglutide had over a 4-fold increased risk for developing NAION compared to patients on a non-GLP-1 receptor agonist. But this study had major limitations. It was done at a single neuro-ophthalmology clinic, which is a major referral center for NAION, at a single academic institution. And even the authors suggested that really a much larger retrospective multi-center cohort study is needed to confirm, refute, or refine their findings. And so the Odyssey community was very well poised to respond to that challenge. So we launched a network study looking to see if there really is an association between semaglutide use and NAION. So to highlight the capacity of the Odyssey community to address critical gaps in evidence in a timely fashion, this was the study timeline. So the paper came out July 3rd. By the following week, Patrick had announced our network study at a Tuesday community call, much like this one. By the following week, we had met within the Eye Care Vision Research Work Group to discuss the phenotypes and finalize the protocol. And by the beginning of August, all the data partners had contributed results. And this whole process took about 4.5 weeks. And the reason we're able to respond so quickly is because of the infrastructure that exists within the Odyssey community. We had really engaged community members through the Eye Care Vision Research Work Group and the Odyssey community at large who came together to define the phenotypes and finalize the protocol. We had data partners through the Odyssey Evidence Network who were willing to run our Strategist pipeline and a whole suite of pre-built open source analytics that are already designed to answer these standard Odyssey questions. And so we were able to recruit 14 data partners that you can see here. We identified adults with type 2 diabetes who were new users of these medications, semaglutide, dulaglutide, exenatide as the GLP-1 receptor agonist, and empagliflozin, sitagliptin, and glipizide as the non-GLP-1 receptor agonist. And this we built upon prior work through the Legend Type 2 Diabetes study that we heard a lot about at last year's Global Odyssey Symposium. We created 2 different phenotypes for defining NAION, one that was a little bit more sensitive to pick up more cases and one that was more specific. And this, we had to mobilize the Eye Care Vision Research Work Group and the experts there. And we used 2 analysis methods. The first was a new user active comparator cohort design in which we compared new users of semaglutide to propensity score matched new users of dulaglutide and exenatide, et cetera. And we also used a self-controlled case series in which patients with NAION served as their own control. And we looked at the incidence rate ratio of NAION comparing, for example, semaglutide exposure compared to control time. And we did that for each of these medications. We identified over 37 million patients with type 2 diabetes, over 800,000 new users of semaglutide. In the main analysis, the new user active comparator cohort design, we found that really semaglutide did not show an increased risk for NAION compared to dulaglutide, the other GLP-1 receptor agonist, or the non-GLP-1 receptor agonist, with the exception when we use the specific definition of NAION, we found there was an increased risk comparing new users of semaglutide with empagliflozin. And in the self-controlled case series, we saw an increased rate of NAION associated with semaglutide exposure compared to control time, and this was consistent across both NAION phenotypes. And we did not see an increased risk for NAION across the other GLP-1 receptor agonists or the non-GLP-1 receptor agonists, which led us to also conclude that we are seeing a small increased risk of NAION among type 2 diabetes patients exposed to semaglutide, but this risk is much smaller than the original authors reported. And for prescribers of semaglutide should keep, weigh the concern of NAION with all the other therapeutic benefits of semaglutide. And I just wanted to mention that since our paper came out, lots of other observational health studies have also come out in the literature, really with conflicting results. Some also found an increased risk of NAION, some did not find an increased risk. Some of these studies were using essentially the same database and came to conflicting conclusions, which highlights another strength of the Odyssey network, that because we're able to run the same study package across a diverse data source, we can really see how different study design choices differ depending on the data source. And our entire process of pre-specifying a protocol, all the database diagnostics, cohort diagnostics, and the study diagnostics that we do, it promotes trust in the evidence that we generate. And so I just want to conclude by saying that the authors of that original paper published an invited commentary on our work, and they said that really our community should be congratulated on conducting a thoughtful and well-designed study. So a huge thank you to the entire Odyssey community, especially all the co-authors who were involved in this tremendous effort. Thank you.